Hi, I'm Casey. I'm an occupational therapist. This is our patient Jean today. Jean has or presents with severe lacking of the ability to extend her trunk and utilize her left arm and her trunk muscles on her left side. So, uh, the goal of today's demonstration or treatment session is to help Jean to improve dynamic sitting so that she can perform ADLs at her bedside or eventually at sink side. So the goal of our treatment is to get her to be able to maintain trunk extension so that she can have upright posture and postural control while using her upper extremities to perform ADL tasks. So first, because I said she lacks in muscle activity, especially on her left side and her in her trunk muscles. Those are tonic postural muscles that are deep and require sea icing, which is a facilitatory technique that where I'll apply ice for 3 seconds and then release, and then wait 30 seconds until I apply it again. And this is a technique that's going to facilitate muscle activity of deep tonic muscles. So once 30 seconds has passed, I will ice again for 3 seconds, and I'm going to ask Jean while I'm icing to attempt to contract these muscles. So can you contract your back muscles? Try to straighten up your back. Straighten up your back. Good. And that is the technique sea icing. Again, ice for 3 seconds while asking the patient to contract, and then waiting 30 seconds and repeating. And this is in order to wake up the tonic muscles to help for trunk extension. Now for a functional activity, we're going to, like I said, try to work on Jean's bedside ADLs. So we'll work on washing. So for Jean, what I want to do now is use NDT handling to help facilitate her motion so that she can grab her washcloth and then after that rotate to grab the pan with the water and soap in here, and then also rotate to wash her more involved left side. So for this activity, she's going to use her right side, and we're going to focus on facilitating that her ability to maintain thoracolumbar extension as she sits dynamically, moving, weight shifting anteriorly and posteriorly, and then rotating. So first, for handling, the key points of control to facilitate anterior-posterior weight shift, to reach forward at eye level, the table in front of her or the sink, perhaps later on in treatment sessions. I'm going to, one key point of control is going to be at the sternum, and the other on the lower back, the lumbar area, as I ask Jean to lean forward and grab the washcloth on the table in front of her. So can you lean forward? Yep, lean forward and reach. And as I have her do that, again, one key point of control here, the other on the lower back. So now that Jean has her washcloth, as we saw, anterior-posterior weight shift by tilting the pelvis and maintaining thoracolumbar extension, the next movement I'm going to want her to do is upper body trunk rotation toward her more involved side. So that she can cross midline, reach for anything that she might need on this side of her table, her sink, as we go along. For right now, we have her bucket here that she's going to dip her washcloth into, and then I'm going to help her facilitate trunk rotation so that she can wash her left side. So there's a few ways that we can do this depending on the patient's ability. If she needs more, if she needs to rotate more, or if she needs more facilitation, a key point of control that I might use is while I have my knee back here, supporting her pelvis so that she won't fall back and I'm on her less involved side, so she won't fall toward me. So I have my knee back here for support. I'm going to go under and come around here so that I can help her lead with her right arm to rotate toward her left involved side. And then I have my other hand on the scapula and helping her to rotate it so that she can do that. And then she could come back over. Another way is hands on the rib cage. If she's able to, there, I could have my hands on the rib cage here on either side and help for rotation. So Jean, now we're going to rotate. So now that you have your washcloth, so you can wash your left arm. Okay. So I'm going to help you. All right. All right. Bringing her here. So those were examples of NDT handling techniques that can help Jean to dynamically sit, weight shift forward and backward, and through rotation. For today, at Jean's level, that would for her to be able to complete ADLs using those would be a good goal to reach for her today. Perhaps later on, for progression of treatment, a more difficult thing would be rotation toward her less involved side, as she needs to initiate with her more involved side, so it's a more difficult task. That would be one progression up that we might do in future treatment sessions.
I'm Matt Bolton, the occupational therapist today, and this is my client Jean, who had a left-sided stroke a few weeks ago. So today we're going to be working on Jean weight-bearing through her left affected extremity while she does occupationally based activities through her right extremity. In order to prepare her left extremity, we're going to do some preparatory methods to facilitate contraction in her left extremity. So first I'm going to place her limb in the extended position. Okay, and I want you to keep your hand just here. Okay, Jean, so you can maintain your weight on your right arm, but I want you to keep your left arm on the table, and I want you to try and contract your muscles while I'm vibrating, okay? All right, can you try and contract for me? Try and make your triceps nice and hard. Great, thank you. Okay, and the second method we're going to use is I'm going to have Jean shift her weight all the way onto that left extremity, and she can pick her right arm up. And I'm just going to apply some pressure down through the left extremity. For safety reasons, you don't want to put too much pressure. You want to start slow and slowly apply more, but You don't want to risk the integrity of the joints. Okay? So I'm going to do this for 10 seconds. 4, 3, 2, 1. Great. So now that we've prepared Jean's left extremity to weight bear, we're going to have Jean shift her weight completely onto the left extremity while using the right extremity to prepare toothpaste, toothbrush, and to brush her teeth. All right, so I'm going to be in a position of safety where I can help Jean. She's not going to fall back because I'm here. I have pressure on her elbow to help keep her joint locked out and keep her body weight into the table. And then I can even come around and make sure she doesn't fall forward. So Jean, now that I'm here, will you go ahead and try and put some toothpaste onto your toothbrush and then brush your teeth? Good. Keeping all that weight in your left arm. Excellent. Good. Nice circle motions. Excellent job. So if we wanted to make this activity more strenuous or more difficult for Jean, we can always increase the surface. So we can move from a stiff or hard surface to something like a mattress that has a little more give, which will require a little more muscle activation from Jean. A few things we wanted to cover for your safety for when you go home and you're working with your loved ones or caretakers is we want your caretaker to lean you a little to your right to kind of force you to look over your left to watch TV or read or anything like that. Okay, we really want to force you to start using that left side and kind of sitting neutral, not leaning too far to either side.
So the TV's going to be on
a little to your left
on
side.
that side, so I have to turn over.
Correct. Now with that, whenever you're doing an activity, because you don't always notice where your left arm is or other things, I want you to start using the lighthouse approach. So when you're looking for an object, I want you to scan all the way right, all the way left, and back to center. And that will make sure that you look for all the objects in your way when doing activities. Okay. So maybe you can try that real quick.
Okay. So I'm gonna look all the way on this side and then turn.
Perfect.
And look all the way on that side when I'm looking for something.
Excellent.
Okay.
And that way you see everything that's possibly in front of you. And the last is we just want to remind you that sometimes you might forget where your arm is, but it's really important to be aware when you're laying in bed or sitting of exactly where your limb is. So if you're in a wheelchair, we don't want it hanging off the side of the wheelchair, possibly getting hit by the wheel or something like that. So we want to make sure that that's in nice and close. So you have a sling provided by the doctor that you can wear. And same with bed. We want to make sure you're not laying on the limb at all. So just make sure that you or your caretaker puts it in a position that will be safe and out of the way from other objects or yourself.
Okay.
Excellent. Great. Look forward to seeing you tomorrow.
Thanks.
Yeah!